All right, well, thank you so much for the invitation to come and speak with you guys. I'd like to just tell you a little bit about the work that I do at the University of Delaware. I'm an associate professor within the Department of Physical Therapy. I am a physical therapist, and I did all my training at Boston University, mainly working in clinical epidemiology and research and training unit there under a rheumatologist, David Felsen, and then sort of stayed on as a junior faculty member, and then in 2014 came down to University of Delaware to take a faculty position in the Department of Physical Therapy. So primarily my work started with really investigating physical activity in large observational studies. That was the sort of work that was done at Boston University using a large cohort study called the multi-center osteoarthritis study, which took people with or at high risk of knee osteoarthritis and followed them. And they had some really nice measures of physical activity and physical function that no one was doing anything with. And then I sort of fell into it and just thought, wow, what rich data set to have and take a look at. And since then, since coming down to the University of Delaware, I've had the pleasure of starting a lab and really trying to look at not only continuing the observational studies, but starting a clinical research arm where we're actually doing clinical trials into trying to promote physical activity as well as look at the relationship of physical activity to outcomes, including structure, pain, and physical function. So what I want to do is just basically give you a major overview. Our lab goal is to help basically people with arthritis become more active. And this really comes from the literature that exercise and specifically physical activity is helpful for people with chronic diseases. So this is a meta-analysis of walking or aerobic walking programs for adults with chronic musculoskeletal pain, and for outcomes including in the short term, intermediate term, and long term. There were positive effects that favored the walking intervention for reducing pain. And this sort of follows along with the 2018 physical activity guidelines that promotes that summarizes all the literature to date in physical activity and finds by and large, and no surprise, that being active is quite beneficial for your overall health. So in diseased populations, there oftentimes, as you know, as clinicians, for the clinicians out there, there can be misinformation and myths. And sort of for arthritis, the major myths are as follows. One, that exercise can't help osteoarthritis. Two, surgery is the only thing that really helps. And three, that walking isn't a real treatment. So to sort of begin to bust these myths, the work that I was doing at Boston University, we took a look at using this large longitudinal observational data set of the relationship of how much people walked with the development of functional limitation or difficulty getting up out of a chair, climbing stairs, and the development of slow walking. And we found that there was a very strong dose-response relationship between how much somebody walked in terms of their steps per day and the development of these problems 2 years later. And what we found in particular was that the number of steps that best discriminated those people who went on to develop problems from those who did not was 6,000. So people who walked 6,000 steps or less were at much higher risk of developing these problems compared to people who walked 6,000 steps or more. So this sort of served the basis of like an initial treatment target or rationale for a treatment target for, well, how much physical activity should one do? And there was a lot of media press that kind of came along with this article. So given the fact that exercise and specifically walking is important, physical therapy and specifically physical therapists, is one pictured here helping a patient in the machine, is a really nice mechanism to promote exercise and to promote activity. For those of you who don't know, physical therapists are doctorally trained clinicians who are experts in not only exercise, but specifically prescribing exercise and progressing them, but then also assessing patients' underlying impairments and putting together a picture of like what actually is going on with them from a movement perspective. As well, physical therapists spend a fair amount of time. You might think of a PT or physical therapist as someone who does hands-on, but a lot of the therapy involves education and helping patients think more about, well, what is the disease process, and how should I think about it, and how is these interventions going to help me in my condition. So a major advantage too of physical therapy is that we get to see our patients multiple times. So typically for osteoarthritis, a course of physical therapy would be coming in 1 to 2 times a week for 6 to 8 weeks, depending on what their underlying impairments and functional limitations are. So there's a lot of opportunity to develop rapport and help patients get better in the long term. So a recent development that's been really facilitated with COVID is the use of telehealth for physical therapy. So a colleague of mine, Arana Himan from University of Melbourne, conducted a study several years ago where they give physical therapy through the phone, literally picked up the phone and called patients who had osteoarthritis. And what she found in a paper published in the British Journal of Sports Medicine was that there's statistically significant improvements in patients' functioning, that they did better functioning compared to a control group that received usual care, which was essentially like online resources. And this was a sort of major groundbreaking study in the sense that physical therapy, not being hands-on, but more through the education of patients with here's the exercises you should do, and coaching them through that was helpful for a clinical population. We sort of took this idea of using telehealth and modified it in incorporating video conferencing. And we have an intervention that we developed that uses exercise, pain management, and physical activity, namely a walking program that involves giving a patient a Fitbit monitor and step goals, and have implemented this in a study to look at its effect on patients with osteoarthritis. As well, and perhaps even more important component of this intervention program, which we call Delaware Peak, is that we have education that's incorporated that works on busting the myths that I went through earlier with regards to exercise and osteoarthritis. It's just amazing with how much people, if you don't, they'll do the exercise sometimes, but if they really don't believe that this is actually beneficial or something real, there's really little chance for them to continue exercise and really adhere to this treatment. So we feel that doing this exercise, this education piece is incredibly important. And we currently have a study where we're funded by the Rheumatology Research Foundation to take a look at Delaware Peak, that is this telehealth study among 100 people with osteoarthritis. And an innovative part of this intervention is that we are recruiting people solely online within the continental United States, and they're randomized to either receiving the intervention or a control, or being in a control group that receives web-based resources, which is a narrated, there's a video of a physical therapist narrating and showing patients, different online resources they can access. And what we want to see is, are there improvements in people's physical activity, that is how much they're walking at 12 weeks and at 24 weeks. So 12 weeks would be immediately after the intervention, and then 24 weeks would be a sort of a short-term follow-up. So this is an ongoing study, and as I said before, we're recruiting people online. These are some of the examples of the Facebook ads that we have been using to recruit individuals. And to date, through the end of May, we're on target for recruiting our 100 people. We had a little bit of the blue line represents our projected or anticipated recruitment, and the red line is our actual number of people who are randomized. And at present, right now, we are back to where we anticipated being. And what's really interesting is this is a representation of the blue of the United States, obviously, and the blue represents states that are represented in our study. And we have a wide representation of states, and this is among about 60 participants. So we have 35 states and a large number of underrepresented patient populations in our study. I think they represent about 20% of those who we recruit. So for recruitment online, it's been really, really much more diverse and from a larger geographic portion than what we typically recruit from University of Delaware. An interesting thing I wanted to just share with you really quick is that we just submitted an abstract that was led by my doctoral student, Jessica, and she took a look at the number of clicks and how that actually boils down to the number of people who consent for the study. And for the first, I think it was first 30 people, 32 people that were randomized into the study, they came from over 10,000 Facebook clicks. And that basically boiled down to 400 people filling out a screening form, 300 of them being eligible, and then 100 of them actually being contacted. And of the 70 that were eligible, half of them ended up signing up, or a little less than half. So it's a big number of reach and clicks that happen online, but the actual number of people that sign up is much lower than that. Nevertheless, it's still a very effective means of recruiting people, and we recruited 32% of our cohort, again, within the first couple months of our study. So it was quite efficient. And I'm kind of out of time, so I just wanted to give a couple acknowledgments. This is my lab. They do all the work, to be quite honest. I'm the one who writes grants and tell them that they're doing a great job. This is our website, and if you have any patients that have osteoarthritis and are interested, just direct them to this website, and they can fill an online screening form out. Yeah, that's pretty much the overview of my talk. So I'll stop here, and I'm not sure if there's time for questions, but I'm happy to answer if so.